We've used benchmarks before. Actually, these benchmarks are not new to us. It's just that they weren't, they were not uniformly applied, but they have never been put together. So, how can I say succinctly and together as the optimization guidelines show. So the optimized recovery guidelines are those are my go-to because I cannot drill down into almost any level. I can do it in a quick level. I can drill down into a much deeper level. And then what is most useful is because it's evidence based, you can get these hyperlinks that show you where the evidence is coming from. This is not something that we made up, just because we want it to be easy or financially better for us. These are good, solid, evidence based guidelines that keep the patient in the center of the focus. So if I quote 3 articles from New England Journal of Medicine that show that this is the right way to do things, it makes my argument much more viable, that I'm doing the right thing. And it's also a good training tool. That's the other thing that's a spin-off that we've had is when we start doing these exercises, because we are a resident-driven institution, the residents are hungry to question. And they will say, well, why are you doing this? And I'll say, well, I just looked at sepsis the other day. It was a pneumonia, and there were 83 references that one could go to say, well, this is why we're doing it. So that sort of backup and that sort of validation is really important. It makes whatever argument you're making for the length of stay to be shortened much more stronger if you know why you're doing it. Because every single day that the patient spends in the hospital that is extra is not just about the money. It's also about patient safety. And this morning we heard it over and over again. Medical errors cause more deaths than anything else. And as an emergency physician, there's a joke that if you keep a patient for an extra hour in the emergency room, that's a 10% increase in mortality. And anything we can do to save that would be to the patient's advantage. And I think that's the focus that we need to flip this. It's not about money. It's about good care. We heard today that, poor care, the waste in poor care is affecting patient safety. And the waste also in management is causing irreparable harm. So these two wastes need to be trimmed. And I think that's where we find the most valuable partnership.